Are we treating high cholesterol completely wrong? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. And in this video, boy, if you had any kind of pushback from your doctor about cholesterol, about statin treatments, about a low carb and keto diet and what it will do to cholesterol, you got to watch this video. And I'll tell you my thoughts at the very end. Always consider the source, and this is Dr. Sunil Dand, who is a GP in the UK and not a research scientist, not an expert, best I can tell, but a general doctor in practice. Let's hear what he has to say.
Hello everyone, Dr. Sunil Dand, internal medicine physician. Welcome to another video. What if the whole way that we think about high cholesterol, what if our whole paradigm is completely wrong? Because high cholesterol is everywhere nowadays. It is estimated that 1 in 2, yes, 50% or more of all adults in the United States have a diagnosis of high cholesterol. Why do people have this diagnosis? Why 100 years ago was it not a thing? I think there are lots of reasons why people are living longer nowadays compared to 100 years ago, like improved child mortality rates, like the fact that we have antibiotics so people don't die of simple infections, like the fact that we don't routinely march millions of young men off to war to go and fight and die for a cause that they barely understand. Thankfully, that's not happening routinely nowadays, but think about how all of those factors greatly reduced life expectancy for most of human history. And of course, we know that the diagnosis of high cholesterol nowadays invariably leads to a statin prescription.
So let me just stop there. I like his style, looking at the big picture, and what he's trying to rebut here is the argument that some people make that the use of medications to treat cholesterol has been one of the most important reasons why people live longer if they do. And remember, cholesterol is not a disease. It is an essential molecule that's in every cell of our bodies. In fact, it's so essential, just about every cell can make it, but it's a very difficult molecule to make. It takes a lot of energy to do it. But so, yeah, there's so many other things that can be attributed to people doing better today. I have to go along with him on that one. And yes, if you get measured and your cholesterol is high, the LDL, the low density lipoprotein, is high, then in my area and in most areas of this country and apparently the UK, you'll be asked to go on a medication. So, stop right there. If someone says you have a high cholesterol, ask, is there anything else I can do? Like a lifestyle change. And you see, the guidelines actually say there should be lifestyle change first, although most practitioners just leap over that because they don't think you'll make lifestyle change. So prove them wrong. But let's keep going.
These medications are dished out like candy, and they are the biggest blockbuster drug of all time. Statins over the last few decades have brought in hundreds of billions of dollars in revenue, more than the entire GDP of whole countries. So let me explain to you why I believe we have completely the wrong philosophy towards treating hypercholesterolemia or hyperlipidemia. And that is because the LDL, quote unquote, bad cholesterol, that's the low density cholesterol, is not simply a number that needs to be fixed. The actual problem is upstream from there. 3 processes that I would like to share with you that the medical profession largely ignores. They barely talk about it, but these are the core concepts to what causes high cholesterol. Number 1, de novo lipogenesis. This is the process by which excess carbohydrates, and that includes sugars, are converted into lipid molecules, i.e. fat. Number 2, oxidative stress. This is the core concept behind many disease processes. And number 3, generalized inflammation. And hopefully you can all picture that.
Yeah, so this is I think a pretty reasonable alternative hypothesis or explanation of what's going on. And that is that the LDL cholesterol is a function of or trying to fix problems that are, as he says, upstream. so that the fatty liver, where your de novo lipogenesis means you're making fat from the beginning, from de novo, and then lipogenesis, meaning making fat, this happens quite commonly in the liver. And so this is, if you have a diagnosis of fatty liver, it's not from fat in the food, it's from carbohydrate being turned into fat in the liver. And then the oxidative stress and inflammation are things that are going on, causing the damage on the arterial wall. And then the LDL comes in to help repair the damage. And it's fascinating. This concept has been around as long as there was atherosclerosis. There was a recent talk where I saw the language of one of the original pathologists that there were, and looking at the artery, they noticed that there was inflammation first. So if you're really wanting to treat the root cause of the hypercholesterolemia, you would want to treat or reduce inflammation, the oxidative stress, and the creation or generation of fat. Of course, if you're a patient of mine, you know that cutting out carbohydrates is a very effective way to do all of these three things. But the other interesting thing that he didn't mention is that when fat is sent out from the liver, it's actually on a molecule or particle called very low density lipoprotein, or VLDL. And those VLDLs, when the triglyceride is removed, become LDL. And when that particle, these LDLs, go around, they become small LDLs. So the small LDL is thought to be the bad LDL. So now that you know there's LDL, there's actually a good and a bad LDL. It gets ever more complicated. So the small LDLs come from the VLDLs, which actually come from the extra fat being made in the liver put on these LDLs. So the small LDLs actually comes from the carbohydrate in the diet. That's putting that link from the diet to the fat in the liver. So it's a really good point. Other times you've heard of this, you might have heard that the LDL is like the ambulance, the fire truck going to help at the scene of the inflammation, to put out the fire. And that idea has been resisted because the model or story that has been perpetuated is you want the public and doctors to think that the LDL itself is bad, and you want to lower it because there are drugs that do lower the LDL, but the drugs also have other effects called the pleiotropic effects, which actually might exert some of the positive benefits. But so his point is that once the LDL is involved, it's actually kind of late in the stage of the process.
And doctors get very excited that they prescribe a statin and then they fix the number. But what does fixing the number actually do? Because statins are designed to lower the cholesterol. That's what they will do. But what does that achieve? What are the actual outcomes and positive benefits? Because you haven't even touched the upstream problems, which are oxidative stress, de novo lipogenesis, and generalized inflammation.
So, it's even worse if you think of the downstream problems. So cholesterol is not the disease, it's atherosclerosis. That's the disease that we're trying to prevent by measuring and treating cholesterol and inflammation, all these other things. So the LDL is kind of in the middle, the downstream effect of all of this process. What we're trying to prevent is the hardening of the arteries, or the narrowing of the arteries, the fatty streaks and buildup in the arteries. And that's why I keep talking about measuring the pipes. You want to know what your arteries are, not what just the blood is. You don't want to be put on a pill for preventing a disease that you don't have when you're 70 years old. That makes no sense. If you've lived a life you have no evidence of atherosclerosis, it happens, then there's no reason to be put on a medicine to reduce or eliminate the risk of a disease you haven't even started to develop near the end of your life.
And if you actually dive into the studies, if you actually follow the science, I've talked about this before, and you break down the data, The actual benefits of statins, somebody who takes a statin religiously for a long time, the benefits are not what you might expect in terms of improved life expectancy and reduced risk of cardiac or even stroke events. Nowhere near what you might be led to believe. If a doctor ever told me, Sunil, you have high cholesterol levels, you need to take a statin, well, I would have zero interest in taking a statin. I would take a step back and think, well, why do I have high LDL cholesterol? What is the upstream problem? Let me fix the root cause. And I would focus on a number of different issues. I would be razor focused on lifestyle. What am I eating? Am I eating a clean, natural, real food diet? Low in ultra-processed foods, minimize sugars so that de novo lipogenesis cannot take place and the resulting oxidative stress and inflammation. We get so excited about fixing numbers, putting band-aids on problems. We never deal with the root causes. We never deal with the upstream problem. And that's why chronic diseases keep on proliferating. Every year, we throw more and more medications at people and everything keeps getting worse because we are focused on the wrong things and we are heading in the wrong direction. And we are eventually going to meet a tipping point where we collectively realize that we've been doing everything wrong. Our whole philosophy, our whole paradigm is misguided.
Well, I like his style, and I like the idea that he's a big thinker and showing that there are other things going on that can be treated by lifestyle for sure, and maybe medications. But so we're in what's known as a paradigm shift, where the current treatment that most doctors are using and the guidelines that they follow recommend that you measure the total cholesterol and the LDL cholesterol and that you treat the elevated cholesterol. And if you have heart disease, the idea is that you want to even keep that LDL as low as you can. And most doctors just think of this thing as something that's unhealthy. Well, the LDL actually does more than cause heart disease, if it does, or if it's in this process. It actually shuttles around fat-soluble vitamins and fat-soluble compounds like cholesterol. Anything that needs to go from the liver to the cells, from the cells to the liver, or cells to other cells, needs to be carried around on a fat-soluble particle, because the water is, the bloodstream is aqueous or water-based. So you have these trucks carrying around things, and if all you do is lower LDL, LDL to LDL, you're lowering the shuttling of all of these vitamins and other really important substances. So in theory, that is not a great idea in my mind. Although the studies and the mainstream medical organizations, which I'm still in, I'm have a foot in the new and a foot in the old paradigms. And if you're going to be eating a Western diet, one that has all of these carbs and the junk, as he's talking about what you don't want to do, there are a lot of studies that show that if you add a statin or other cholesterol lowering medicine, you will have fewer heart attacks. And you will, the evidence for secondary prevention, meaning you've already had a heart attack or a stroke, is not bad. I mean, even if you look at the before and after, it looks like you're going to get some benefit. The primary prevention, which is the prevention of the first heart attack or the first stroke with these medications, to me and to other medical organizations, even ones that have been around a long time, the internal medicine societies, not just the cardiologists, but the other kind of the critics within this world, the U.S. Preventative Service Task Force, look at the evidence, and the statin decision aid tool put out by the Mayo Clinic is a great one to look at the actual risk and then the risk that it would be if you were going to take a medication. Of course, that presupposes that you're eating an American kind of diet, because that's the studies that have been done. That's the community that these studies showing that you can get some benefit from these drugs. Another way to go about this would be to target the metabolic syndrome, which is triglyceride and HDL in the blood, the abdominal circumference, the blood pressure, the blood sugar, and then use lifestyle to treat the metabolic syndrome. So currently these paradigms are seemingly at odds, but actually we're all on the same team trying to prevent or reduce the likelihood of you getting atherosclerosis, the hardening of the arteries, the narrowing, the blockages. That's the disease we're trying to prevent. We're using, in the low-carb keto world, the tactic of treating metabolic syndrome, but historically most doctors only know about checking total and LDL cholesterol, and that's where the friction comes in. He was very polite in saying that doctors are enthusiastic about prescribing statins. No, in my world, people tell me that doctors are actually striking fear into them if they don't take this medication. And so, it's not like you're on the edge of a cliff. You want to ask, well, what is my risk? What would my risk be if I took this medicine? Ask that in a calm way. You could even go to the Mayo Clinic Statin Decision Aid Tool or the American Cardiology website, where they have your ability to look at your risk and look at it rationally. I'm afraid most practitioners follow guidelines that will be happy to make that decision for you. I'm more now into a personalized personalized medicine, where we actually make the decision together, called shared decision making. And I really like Dr. Sunil Dan's approach here. At times it gets a little off, overgeneralizing perhaps, but I think we are treating high cholesterol in a inappropriately single-minded way. And we are focusing on cholesterol as a disease, we meaning the medical world, not me personally, and that's just not right. Cholesterol is not a disease. It's an important compound we need, and that overreaction and pendulum of just measuring and treating, it's got to come back. It just has to. And there is a role for medications that lower cholesterol. So my stance, if you want to know my policy, if you're going to eat in a typical American diet and eat lots of carbs, and you've had a heart attack or a stroke, it's called secondary prevention, then you'll want to take a cholesterol-lowering medicine. That benefit is pretty big, and it's not just in my mind, but in my patients when I show that. Of course, most of my patients decide not to follow that American diet, which gives you the benefit of drug is seen in. So just as a final word, that Rob Lustig put together a great saying, or he's the one I first heard it from, that good food is medicine. Bad food requires medicine. So the way I see this is, if you're eating a typical American diet and the LDL is elevated, your doctor's measuring it, and you decide not to change your lifestyle, then the best decision is probably to take the medication and go down that pathway of not worrying about what you eat and just taking medication. An alternative approach is to change your lifestyle, alter these lipids, and look at the triglyceride and the HDL in the blood, and then perhaps you might not need the medication. This is true for type 2 diabetes as well. If your doctor is not reversing your type 2 diabetes, instead they're focusing on the LDL cholesterol, this is a miscalculation, a wrongly prioritized strategy. You want to reverse the type 2 diabetes if you can, and not worry so much about the cholesterol. So the guidelines say if someone has diabetes, you need to treat the cholesterol, because these people with diabetes die of heart disease. And there's evidence that people treating with drugs for cholesterol, for those with diabetes, will reduce these outcomes. However, you're only on the cholesterol medicine if you have diabetes, because you have diabetes. So I will help people reverse their diabetes, and then when they no longer have diabetes, they don't need the cholesterol medicine anymore. I know it sounds like too good to be true, right? No, it's not. It's any effective lifestyle that has certain principles of protein coming first. You can run your body on glucose or fat. It's really your choice, but you're going to burn for energy what you eat. So I teach a real food-based keto, low-carb lifestyle, and it works really well for all of these things. And I think I'm going to be ending up agreeing with Dr. Don that I think we are looking at cholesterol in the wrong way. I hope that's helpful. Please like, ring the notification bell, and subscribe so you don't miss out on further content. I'm sending out new videos on Wednesdays and Fridays now. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.